What's going on, guys? Medicine in 3 minutes, back here with another video, and today we're going to get straight to the point. We're going to keep the subject clear, brief, and illustrated, so let's get started. So today we're going to be talking about sickle cell anemia, and generally this subject is very long, has a lot of text involved, a lot of notes, a lot of content, but hopefully we're going to lighten the load today, make it a lot more visual, a lot more simple, and really keep it purely to the essentials and what you really need to know. So yeah, let's get started. Now, for sickle cell anemia, the hemolytic anemia is actually going to have certain prerequisites for it to become sickle cell anemia. Now, the MCV levels, which are the mean corpuscular volumes, they're going to be normal. The LDH levels are actually going to be high, and for you guys who don't know, LDH is lactate dehydrogenase levels, and the indirect bilirubin is actually going to be high, and the haptoglobin levels are going to be low. So yeah, those are going to be the criterias that all need to be met. So what is the physiopathology? Now, first of all, when it comes to HbA, there's going to be two normal alpha subunits in green and two normal beta subunits in blue. When it comes to HbS, there's going to be two normal alpha subunits in green again, and the only difference is there are going to be two defective beta subunits in yellow this time. So in sickle cell, individuals are homozygotes in beta gene, which actually cause valine to replace glutamic AC in 6th position. So in A6 position. The result is the defective form of the beta subunits, which are in yellow. Now, for number two, um, when the RBC takes a sickle shape rather than the biconcave disc that it generally has, it tends to usually clog up and get stuck in the vessels, depriving distal tissues from being supplied with fresh oxygen. So there's a lot of clogging and congestion. Now, what happens is the occlusion from the sickle cell actually causes infarct anywhere in the body. It could either be the bone marrow, the spleen, and in some cases, strokes are actually communally affected. Now, when it comes to heterozygosity, actually confers protection against malaria. So basically, what this means is if you are dealing with sickle cell anemia, you'll actually be protected against malaria. Now, when it comes to hydroxyurea, it is actually used as a treatment to produce more HbF in place of the HbS, which actually has affects the two normal subunits and the defective beta subunits that you can see here. Now, when it comes to sickle cell anemia, there's actually going to be 6 organs that are affected. The 6 organs, as are indicated here. So, what are those 6 organs? They are the first of all is the brain. Now, in the brain, more specifically, you can have microembolisms or TCCVA. Secondly is the lungs, where you can generally find acute chest syndrome, severe infections in some cases, and pulmonary embolisms. Third is the bone. Now, the bone actually has a lot of bones that can be affected. Now, the first is just simple infarction. Osteopenia is one. Bone marrow is a possibility. Fat embolism, aplastic crisis, and parvovirus B29. Now, the fourth is spleen infarctions. Now, when it comes to spleen infarctions, the first is going to be acute infarctions. The second is going to be splenic sequestrations. And the third is going to be chronic infarctions. The two that are left are functional splenia and infections and sepsis. Now, when it comes to genitourinary, you will have renal insufficiency and priapism. Now, lastly, when it comes to the skin that is affected, you can either have Raynaud or phenomena. Okay, so just a little recap of the 6 organs that are affected. The first is the brain. The brain is usually microembolisms. When it comes to the acute chest syndrome, which is for the lungs. When it comes to the bones, it is marrow, fat, embolism. When it comes to the spleen infarctions, good one to remember. And when it comes to the renal, it's going to be renal insufficiency, priapism. Now, lastly, when it comes to the skin, it'll be Raynaud and phenomena. So yeah, again, just a little recap of the bone because it is a very long one. You will have an infarction and osteopenia, the bone marrow or fat embolism, aplastic crisis, parvovirus B29. So the bone again, infarction, osteopenia, bone marrow, fat embolism, aplastic crisis, parvovirus B29. Something that is very important to remember is actually when sickle cell affects kids, and the child has a sudden drop in hematocrit, it is actually called an aplastic crisis. Now, sickle crisis from hypoxia will actually lead to dehydration and acidosis. So this is an emergency and it needs to be solved very quickly. So yeah, just a little recap of everything we've learned today. We've learned what sickle cell anemia is. We've learned that when it comes to hemolytic anemia, there's going to be a normal MCV, there's going to be a high LDH, and there's going to be indirect bilirubin levels which are high, and haptoglobin levels which are low. We also learned that there are 6 organs that are generally affected, which are the brain, the lungs, the bones, the spleen, the renal organs, and the skin. So those are the main things to remember from this video. So yeah, thank you guys so much for watching. Make sure to leave a like and subscribe. Don't forget to leave comments down below. We really appreciate you guys' support. We're on the road to 200 subscribers. We're almost there. So yeah, definitely leave support, like, share, and subscribe. So thank you guys so much and enjoy the rest of your day.